Dear viewers, welcome back to my session. We will talk about abdominal injuries and the vascular with anatomy in the abdomen today. And let's begin with the basic vasculature of the abdomen. As we all know it, the blood supply is coming from the aorta. The aorta, you have four parts basically: the ascending aorta, the arch of aorta, and then descending aorta, and you have the abdominal aorta. So ascending aorta, we all know that it supplies the coronary arteries, right? And then you have the arch of aorta, which is supplying the brachiocephalic on the right side. And then you have on the left side the common carotids and the subclavian. Then in the descending aorta, you have all pericardial branches, and you have the bronchial branches, mediastinal branches, and you have the superior phrenic arteries coming from there. Then you have the abdominal aorta. The inferior phrenic is coming from either the left gastric or the aorta directly from below. Then in the abdominal aorta, you have the celiac branches, and then you have the superior mesenteric artery, the inferior mesenteric artery, the renal arteries, and the iliac arteries. And celiac arteries, you know that they divide into the left gastric, and then you have the common hepatic artery and the splenic artery. The common hepatic goes further and forms the proper hepatic artery, but before that, it gives off a gastroduodenal artery, which forms your right gastroepiploic artery, and the left one is coming from the splenic artery and the superior pancreaticoduodenal artery. Now the inferior is coming from the superior mesenteric artery. So basically when we talk about the vasculature, we will see it in the illustrations also at a later time. And what I was trying to say is that all this vasculature is important because you know where the injuries are coming from. Basically two types of injuries: blunt injuries, penetrating injuries. Blood injuries usually affects the venous system, that is what it's seen, and penetrating injuries can be your gunshot wounds, up to 25% are these wounds, and then road traffic accidents, sharp penetrating objects, and this is what can harm the abdomen in some way or the other. So we have to manage all these injuries. And patient has come to you with an intraperitoneal bleed, and you need to find out which vessel is involved in it. And finally, what is the status of the patient? Whether there's a severe shock, the patient is in, there is hypothermic hair, or the patient has got acidosis, or there is a intraperitoneal bleed, which is you can see. Basically, you will see whether it is an intraperitoneal bleed or a retroperitoneal bleed. If it is intraperitoneal, then there's early chances of mortality in that because the patient is compromised to a higher level. So in this case, explorative laparotomy would be a good option. If it is a late presentation, so maybe the hematoma is contained retroperitoneally, and then you know whether retroperitoneally it is a supramesocholic injury or an inframesocholic injury. And then you have certain zones. Then when we talk about the zones which are and the vessels which are there, it is also in two parts, the right and the left. Usually the right side is the one which has all the collections post-operatively because of the connection with the pelvic peritoneal cavity through the right paracolic cutter. So that is where the whole this is. And then you have inframesocholic compartment. These form zone 1. Basically the zone 2 is formed by the paracolic cutters, and zone 3 is formed by the pelvic cavity region. So basically all these zones are made for the management of these injuries which are present, so that accordingly you know what vessel is involved and how do we approach those vessels by your visceral rotation technique medially, right or left, because basically you have to expose these vessels, the aorta and the branches below. That is obviously to be done in a multi-speciality area. So basically you just need to know what are the vessels here and how do we approach them. So this is a patient has come to us with a injury abdomen, the blunt or a penetrating one, penetrating injuries have a mortality up to 60% also. And what we see is that whether there is a hepatic injury or a splenic injury, hepatic injuries you can uh, manage by up to 85% of cases by a simple packaging of gauze inside the wound by compressing it. But you have to be careful that within 24 hours you don't just let it stay there, because that will lead to some bacterial contamination, or it can lead to any compression of other ischemic, lead to ischemia by any compression to the vessels below. So these are the basically things. Then we need to resuscitate the patient, and that is very important. And you need to know whether there is anomothermia, which is there, and continue with the injuries. Basically, spleen. What you can think of is that there are grading systems there, and like grade 5 is a completely shattered spleen. Grade 1 spleen is like you have less than 10% of the hematoma subcapsular, and the intraparenchymal the spread is around less than. So basically, when we talk about management, also we should know that unstable patient obviously goes for explorative laparotomy. Stable patients, to a certain extent, you can do a fast procedure, which is focused assessment of sonography in trauma. So always remember that a BAT is fast. BAT is your blunt abdominal trauma, and fast is your focused assessment in this sonography in trauma. So these are the things, these ultrasonography, and you can, like this, you can measure which part of the body is affected, and how do you approach the case. So let us go now and see how it goes. Now we'll show in the illustrations all these arteries one by one. So first, when you see here, this is the abdomen. What you're seeing here, this is the aorta, which is coming from the thorax. This is dividing into your iliac arteries, okay? And what you are seeing here, one by one we'll go. This is the left suprarenal gland, this is the spleen, then you have the kidneys, you have the superior mesenteric artery, which is a branch of the abdominal aorta directly. Then you have this colon, which is there, inferior mesenteric vein, artery and vein. Then you have testicular artery and vein, ureter, vas deferens, and on the right side we can see there is a phrenic artery. Phrenic artery is, the branch superior phrenic artery, and the inferior phrenic artery is there. Then you have this, this is a very general diagram which you can see of the abdomen, and it's just for an idea of this. So next one, what you are seeing is your you have the superior epigastric artery, which is here, the inferior epigastric, which is coming from the external iliac artery branch, and then you have the deep circumflex arteries. Yeah, these are all superficial arteries which you will see in the deep arteries. You have this aorta, which is supplying the left renal, the right renal areas. You have gonadal arteries, the left colic, internal iliac, external iliac. All these arteries, like this is your aorta, this is dividing into your common iliac, then this is your internal iliac, and this is your external iliac on both the sides. Then you have this structure here, which is showing the pancreas to you. The yellow structure is the pancreas. This is the duodenal structure. These are the kidneys. That is the spleen. You have the splenic artery, which is a branch coming from the celiac artery, and you have like common hepatic, left gastric, and splenic. So these all branches of the celiac plexus, which is there. Then you have behind you have the veins, the inferior vena cava. And then, like we talked about, this hepatic artery gives off a branch called the gastroduodenal artery, which supplies the duodenal and the superior pancreatic artery, which can be seen there. Like this is the structure of the vascular structure around the stomach region, which is present. You have the gastric arteries and your splenic artery and celiac artery, then you have hepatic artery, gastroduodenal, right gastric. Then this is the structure of the liver and gallbladder there. This is the gallbladder arteries, which we'll talk about the gallbladder in the gallbladder chapter. Then we'll talk it in detail. So this is the pancreatic duct, arteries, splenic arteries, and spleen. This is the basic structure of the portal system, which is there. Then you have the superior mesenteric branches, and you have the right colic, middle colic, arteries, the artery of Drummond that we call it, marginal artery of Drummond, which is here, and inferior mesenteric artery and superior rectal artery. Then you have this is another branch showing the superior mesenteric artery, and which is giving up a right colic and a middle colic artery. And this is your cecum, ascending colon, hepatic flexure, transverse colon, which is present. Similarly, you have another inferior mesenteric artery, and the branches, you have the sigmoid arteries supplying the sigmoid colon. And finally, you have the branches of the iliac arteries, which is the external iliac artery and the internal iliac artery. Then all the branches of the internal iliac artery, which you can get here, inferior vesicle, superior vesicle, and then you have obturator branch. And then here you have the lateral sacral, superior gluteal, supplying the sacral region. So this is the zone 3, what we were talking about. This is the pelvic zone 3. Where all the vasculature is present. So we stop here, and then we will talk about all this later. Okay.